Farmers, fair-skinned people, sunbathers, and some people's genetic DNA. What do they have in common? How about Bob Marley, John McCain, Khloe Kardashian, and the late President Jimmy Carter? These are the people who have the risk or have been diagnosed with melanoma. You may think, what is melanoma? Melanoma is a potential fatal skin cancer, yet it can be prevented unless it's genetically inherited. Hi, I am a certified surgical tech, and my specialty is oncology, which is the field of cancer. For 24 years, I have been involved in surgeries involving various skin cancers such as basal cell and squamous cell carcinomas. However, the most serious form of skin cancer is melanoma. According to Moffitt's Cancer Center, melanoma is an aggressive skin cancer that begins in the melanocytes, which are the cells that produce the skin color. About 3% of white people, 0.5% of Hispanic people, and 0.1% of Black people have a lifetime risk of developing melanoma. How might this be? Well, when the skin is exposed to UV rays for an excessive amount of time from the sun or tanning devices, this can trigger cell DNA damage, which causes the melanocytes to develop skin cancer cells. You may find changes in your moles or freckles that you may have, or you might find new lesions in scaly patches of skin. This may occur from head to toe. You may need a trusted friend or partner to assess your skin to check for new lesions. If abnormal changes occur in your skin, consult your healthcare provider immediately. Your healthcare provider will assess your skin and look for indications of questions about suspicious lesions. The provider might do biopsies to find a diagnosis of any lesion that looks suspicious. If the diagnosis is confirmed as melanoma, further treatment will be needed. The treatment may be minimal or aggressive, depending on the investment of the melanoma. But first, the physician must determine the thickness of the melanoma, if it has spread to your lymph nodes, and if it has spread to other areas of your body, such as the brain, liver, or lungs. This also helps stage the melanoma from 0 to 4, with 0 being a localized area and 4 meaning that the melanoma has spread to various areas of your body. The provider may also request an X-ray, an MRI, or CT scans to see how far this melanoma has spread. Once these factors have been determined, treatment can be started. The first step of the treatment is the removal of the melanoma. The surgeon will excise the lesion and close the healthy skin. If the skin cannot come together, then the surgeon will remove skin from the inner arm or inner thigh to place on the defect. Then a few weeks later, chemo or radiation therapy may be started to help the body rid the melanoma cancer cells, and this will also help prevent reoccurrence. Although 5 to 10% of melanomas are inherited, they can be prevented. Avoiding your UV radiation is one way to prevent melanoma. Wear a hat and protective clothing. Avoid peak sun hours between 10 a.m. and 3 p.m. and use umbrellas for extra protection. Apply sunscreen as directed and avoid the sun by being in the shade whenever possible. These rules apply even on cloudy days. Remember, melanoma is a deadly but preventable disease. If you find an abnormal lesion, have it checked and treated. The sooner, the better. Also avoid risk factors that will cause melanomas to develop. You only have one bodysuit. Take care of it.